And Dr. I just wanted to ask, what made you interested in bringing health coaches into the care model for your patients on GLP-1s?
Well, we met actually at the HIN Summit in Denver last year, right? You and I. And, I liked your energy. I knew also that without accountability, most weight loss programs fail, right? They fail within the first 3 months, most of them. Yeah, and the patient just gives up. And then they're so discouraged by the fact that they failed at that they don't want to do something else, right? But when you have a human element making you see them, right, every week for 12 weeks or 6 months or 1 year, you have an engagement of the patient, because what happens is the motivation falls off. They don't see the quick change, so they lose interest, right? They say, and then they give up, and then they adopt the mindset that, I'm never going to lose weight. That's not true. You just need the right tool. And the tool is always having somebody who is an expert in that field, that weight loss field. And who is better an expert about food than nutritionists and diet coaches and exercise and the importance of exercise in metabolism. How can I get you to exercise unless somebody is there over on you every week telling you, you need to be consistent, you need to be consistent, you need to be consistent? Because discipline is the difference between what you want now and what you want most. Is teaching you the discipline that you need to have, that positive mindset, that nutrition, that diet, that exercise, the sleep, the stress reduction, the aspects, the complete aspect of holistic care. You need every part of these to be successful. There are always different reasons why different people can't lose weight. You need to explore each aspect of that. And that can't happen in the 15-minute visit, right? It needs to be a concerted effort of individuals who are each experts in their field to address this. I am not the best at nutrition, exploration. I know my basics. That's what I did in medical school. And I've learned more over my career, but I'm never going to be a nutritionist. I'm never going to be an exercise coach. I know my restrictions and my limitations. So I call in the people who are the best at it, and we work in a collaborative model to make sure that we've done the most that we can do for that patient, and then the rest is up to the patient. How motivated are they? And so when I met you and I saw your passion and your compassion and we can make a real positive change, and you were looking for partners, I was like, this is a strategic partner that I can work with long term. Because Cecilia's really got her heart in it. She has the right mindset. She has the right group of people with her. She has a partner who is interested, and it's palpable. You can feel it. You can hear it in the voice of the person, and it's sincere. We sincerely want to help people, and when you and I align in vision and goals, then this is an unstoppable team for our people.
I feel that, and that's so beautifully said. And thank you for expanding on all of that, because this is really the future of healthcare. Mm-hmm. Is the doctor plays a very, very important role, and the doctor can't play every role, right? Because there's cultural factors coming into play. There, when the patient goes back home, they go back to the same environment that they got sick in. So where's the medium, right? And so the coaches that are behavior change experts, that's where they step in, and they get to work with your patient one-on-one, having multiple touch points per month, where they get to have that personalized attention. And that's where the change starts to happen and start to gain momentum. And so when they go back to you, they go to get your care, and there's this other part happening in the background, constantly moving forward towards changing their behavior and changing their lifestyle, which is not meant to happen overnight. And it also doesn't happen in 2 appointments of seeing your provider, right? There has to be a lot of in between. And so that's where this partnership, like you said, it can be long-term, because every patient that comes in, something needs to be tweaked of everyone's lifestyle, right? We can all do better. We can all learn. And that's where we support your practice and your patients in helping you seek out that goal with that patient, that they can actually see those viable results. So we're really lucky, and this is the future of healthcare.